welcome to Students Union HUC studio. And today we have Julia Hollósi with us. She's a 6th-year medical student and 2nd-year PhD student.
Hello.
So Julia, welcome to our studio. And could you please introduce yourself briefly?
My name is Julia Hollósi, and I'm a 6th-year medical student, and also now I'm in the 2nd year of my PhD, and I'm also an SMS, or a scientific methodology supervisor, for first-year students in the PhD program.
At the Center for Translational Medicine. So you started your PhD while you were a 5th-year medical student, right?
Yes.
That's quite impressive, actually, while we are all struggling to manage being a med student. So maybe can you explain to us, like, how do you manage your time with all this busy work? How did you balance clinical studies with the research responsibilities early on while you were a 5th-year medical student?
Well, I think it's very important that when you're doing whatever it is that you're doing, you're very focused on only that. Like, I can't multitask. I think most people can't multitask effectively. No. So if you have like 3 things open at the same time, it's just going to take you 3 times as long to get anything done. But if you really, like, when you're in the clinic, then you focus on the clinical work and paying attention and studying. And when you're doing the PhD meetings and you're really locked in the PhD meetings and you're focused on that, then the efficiency is just really helpful. And also all of my supervisors and tutors everywhere were very nice about letting me go for meetings, or if I had to miss a meeting because I had an exam or something that I couldn't skip in the clinics. Like, everyone was just very flexible.
So you have your support system with your supervisors.
Yes.
As well as the clinical studies also help you in this way. Okay. And what was the biggest challenge for you at the beginning in the MD-PhD pathway?
It was the efficiency. It was the time management. And, like, you know what you're supposed to do and you know how to be efficient, but still actually putting it in practice and figuring out how to manage your time effectively. It's a learning curve.
Okay. Yeah, it's a learning curve. That's true. And how did you find your supervisor? Who are they and which department you are conducting your research with?
My research is in the ICU anesthesiology section of the Center of Translational Medicine. And my supervisors are Dr. Zsolt Molnár, Dr. László Zubek, and Dr. Janer Turan, and Dr. David Lacko. And so they are, the first 3 are in the ICU as well, or ICU anesthesia, and the 4th is in radiology. And they were all a really wonderful support system. And they were really helpful in not just supporting me in time management, but also in everything else. If I ever had any questions, they were always there. They answered everything. They were very clear, very effective. So I really appreciate them.
Yeah, so as already Julia mentioned, all supervisors at the CTM, I also work with them as a TDK student. They were very supportive and they are really there for you if you feel lost during the research journey. I think it's very important, especially in the first years of the PhD. So could you mention about how did you find the supervisors? How did you connect with them?
So when I was in 4th year, I was already interested in anesthesia and ICU, and I met Janer. And I was shadowing him for a while in the operating rooms under the anesthesiology. And he was the one who mentioned that they have a PhD program and that it might be something that I was interested in. And then I went, they had these information sessions. So then I went for the information session. And from there, it was just, he introduced me to all of the other supervisors. He was always really helpful. Like, anytime I had a question about the application, about the start of the program, anything.
Yeah. That's how I was also dragged into the research. It all started shadowing Dr. Janer Turan. Find him, guys. He's the man.
Shadow him.
And shadow him. Yeah. He will really convince you to the anesthesiology and ICU world, I can say.
Yes.
Yeah. So, in an American way, Julia, but Hungarian way, Yulia.
Yes.
Where are you from? Can you briefly mention to us?
My parents are both Hungarian, but I was born in America and I grew up in America. I speak Hungarian because they taught me and because I used to go to Hungarian school on the weekends.
Oh, in US.
In the US, yeah.
Okay, that's
So,
interesting.
They've been training me and then I
Yeah.
just came and moved back for university.
That's wonderful, actually, because we have so many Hungarian friends who doesn't speak Hungarian, but they are American. And then the professor, the teacher sees the Hungarian surname.
Yeah.
Bestas Magyarul? No, I don't. So,
Yeah.
so where do you see your career going after the PhD path and after graduating, Julia?
I mean, right now I have options, which is very exciting. I will do half of my facultative block here and the other half in the US. And that way I can compare the systems and see maybe which one I like more.
Okay, cool.
So I'll consider both.
Yeah, where in US?
In Florida.
Okay, very nice, guys.
Yes.
And have you took the USMLE exam so far?
Yes. I took step 1 and step 2.
Oh, wow. Yeah. And how was the USMLE prep? I think we can also a little mention about this since I personally know so many people who are preparing for the USMLE. Not me. So maybe Julia can give us some tips about the USMLE exam. How did you survive?
With difficulty. It was hard. It's if you want to go practice in the United States to apply for residency, you need to take the USMLE United States Medical Licensing Exam. There's 3 parts, but you only take the first 2 parts before you apply for residency. You take the third one after. It's like a massive exam. It's 8 hours. The first one is 8 hours, the second one is 9 hours, and the third one is 17 hours. So that's a choice. No, I just wanted to say when I was taking the exam, like the actual hardest part of the exam is that you have to be focused and sitting there for 9 hours. Dress in layers. Dress in layers because you think, I went in October and it was like cold outside, so the sweater, everything. No. It was 30 degrees in that room. I was sweating. It was so bad.
Can you take snacks with you?
You can take snacks, but you can't bring them into the exam room, so you have to take an official break every time. And the thing about official breaks is you can go out, you can eat your snacks, but when you come back in, they check your hands, your sleeves, everything, under your hair, behind your ears, under your tongue. It's like a whole procedure to make sure that you're not bringing anything in. And I'm like, you saw me. You witnessed me eat my M&Ms in front of you. Like,
yeah. Okay. So
but
they are very
it's serious
strict,
business.
Yeah.
Okay. I think the most important thing about the USMLE is that you need to know that it's going to be really hard. But like, if you can accept that it's going to be really hard and really annoying and you just have to keep doing it.
Being realistic.
Yeah, you just have to like realistically accept that you have to grind and it's going to be a grind, but
painful grind.
It's going to be painful, but it doesn't actually. I think for step 1, I did it in the summer between my 4th and 5th year. And then step 2 I did during the end of 5th year, beginning of 6th year. Because we didn't have a summer break. But I would say step 1 is more memorizing, especially because it's all of the preclinical things. And so there's a lot more like focused work that you have to do with that. Whereas step 2, I could do it without a summer break because it's clinical material. So it's essentially just a review of the things that you've been doing for 2.5 years.
Yeah.
So
actually, the USMLE for the step 1, like all the material is already covered by at the end of 3rd year, right?
Yeah. And actually, if I could do it again, I would take it then. Because the material is fresher. Because I waited until after 4th year. But I did not need to. Because they really don't ask the clinical things that you come across in 4th year. And by that point, you're already starting to forget more of the anatomy and the biochemistry and all of that. So
it's a great tip for the people who are in the first 3 years.
But with
take
step
the
2,
exam.
sorry.
With which one? Step 2?
With step 2, I would wait until like 5th year, end of 5th year. Because then you actually really need the clinical knowledge and the rotations help a lot.
Helpful, that's true. Okay, so take home message is you can take the USMLE step 1 after your first 3 years. And for the step 2, which consists of the clinical part, wait until 5th year. And which sources did you use for the USMLE exams? UWorld, I know.
Yeah, I used UWorld.
Yeah.
I heard that Amboss has a similar question bank, but I haven't tried it, so I don't know anything about it. For both exams, I used UWorld. There's also these NBME questions, like these NBME tests, practice tests, and they're very similar to the real test. So the closer you get to the actual exam day, I would suggest you take the NBME exams.
Okay.
So, because the format is very similar, the question material is also very similar. And then there's a guy. He's a YouTuber, but he also does these PDFs, these summary PDFs. His name is Melman. Michael Melman?
Michael Melman.
Mehlman.
Okay.
And he does really, like, he has this whole database of free PDFs, and they're subject specific. And so any subject that you feel like you need a really good summary of specifically to the USMLE things that are important, especially for step 1. For step 2, not so much. There's not as much clinical material. But like with the biochemistry, because I
biochemistry.
I forgot a lot of biochemistry.
Yeah.
And to like go back into my biochemistry textbook and try to figure out what the USMLE wants when it's such a different system. It was really exhausting. But then you go to the PDF and he lists like what are the things that they consider high yield, what are the things that are important.
What to focus on, so you don't have to dwell on all the details, and you can use your time more efficiently. Yeah, I think that's true. So you didn't use the first aid book?
I started, but it was very specific, and I felt like it wasn't very helpful with the questions. It was going into like a level of detail that you did not need for the exam. I think it's nice as a reference book, like again, biochemistry, because I had to go back and relearn all of the cycles. It was good to have as a reference book, but I would say just reading it is not going to make Ankis.
Make Ankis,
Make lots of Ankis.
Yeah, that's
and UWorld.
Lifesaver, and the game changer. If you have any further questions regarding the USMLE exam, DM to Julia, so she can help you a lot since she completed all the exams successfully recently, and she can guide you. Apparently there is lots of to dig in there. Thank you.
One more tip. Can I give one more?
Of course, go ahead.
One more tip.
One more tip.
Practice the timing. Like, practice sitting and doing the questions in the number of blocks that you will do it. Like, at the beginning, obviously, you go by topic or you go by questions. But once you're actually a month out from the exam, start actually sitting and doing practice exams that are the length of the exam. Because a huge part of the exam is actually the stamina to focus for 8 or 9 hours. So, and also figure out when you want to do your snack breaks, your bathroom breaks, everything. Like, you have to practice the situation as it will be, because it will be. So
yeah, that's so like a different system, because in Semmelweis we've been only having mostly oral exams with the professors, like which are 15 to let's say 30 minutes. It really depends on the topic and the examiners, I guess. Sometimes 2 hours.
MCB.
MCB, molecular cell biology. Oh my god. Do you need to know molecular cell biology for step 1?
Yes.
Yes.
It comes back. It all comes back. Everything you have seen and everything you didn't think you would ever see again, it will be back.
They will be back.
In multiple choice format on hour 8.
Yeah, I think after the clinical years, maybe like 4th or 5th year. Right now I am a 5th year medical student, and usually students divide into 2 paths. Ones are going for the USMLE, like Julia is doing, or the other ones are learning languages, which is me right now, or people who will go back there to home countries.
It's not that bad.
It's not that bad.
I know it sounds terrible, but once you actually get into it, it's not that bad.
Yeah. I think there are so many people like who start to learn German.
Yeah.
In the EU, it's one of the best ways to do your residency. It's more like a fast track. Right now I'm between Dutch and German, so my path is going to there for the residency and the PhD. So there's USMLE option, there's learning a language and go for that country option. Because in EU, like except for France, Spain, they have the state exams.
Yeah.
But other countries like the Netherlands, Belgium, I think Norway as well. They do not have exams. You just apply to the hospital depending on the specialty, how competitive is the field. Is anesthesiology competitive in US, by the way?
Yes.
Yeah, it's
Very.
also, well, it's good that you are
Yes.
doing the PhD and all the research work, so you can make your employee happy.
But you know, I have to decide because
Yeah.
in the US they separated intensive from anesthesiology.
Really?
Yeah, it's not one anymore.
Okay, that's interesting. Actually, in Netherlands, it's also separated. You need to do extra 1-year fellowship for the ICU part. It's different than Hungary, because in Hungary they are all together.
They're together, yeah, but
and for 5 years.
For 5 years, I think so.
Yeah. Okay. So, Julia, can you explain your PhD research topics in a way non-scientists can understand? What are these immunomodulatory strategies in sepsis and why do they matter?
Yes. So sepsis is a dysregulated host immune response to infection. So essentially, it's when your body gets an infection and it creates an inflammation to fight the infection, but the inflammation becomes so big that it starts damaging your own tissues. And it can be very dangerous. It can be fatal within hours even. And so it's a very, very serious condition. And although we have really good treatment plans and bundles, and there's specific guidelines on within how many hours you should give fluids, you should give antibiotics, you should give vasopressors, still very many of these patients die. Unfortunately, wait, let me remember them. I remember the statistics.
Okay.
You know which slide I have in my head.
Yeah, it's in there.
Okay, around 30% of patients in the ICU have sepsis, and unfortunately, around a third of those patients die. So that's a lot of patients.
That's a very high number.
And even now, with the treatments that we have, like still a very high number of patients unfortunately die. And so, what our research is about what kind of treatments we could add on to the standard therapies, which could potentially modulate or lessen this inflammation that is creating such a big problem in sepsis. And so we have things like blood filtration techniques, such as plasmapheresis, hemadsorption, and polymyxin B adsorption, which are all different kinds of blood filtration which filter different inflammatory factors out of the blood. However, in addition, in sepsis, there is an immunoglobulin deficiency, because there is increased consumption and decreased production of immunoglobulins in this hyperinflammatory state. And so we also investigated if we can give intravenous immunoglobulins, or IVIG, to the patients, if that could benefit them.
So your research heavily includes the sepsis, and can you explain to us like what is going on in your body during this sepsis situation?
There's cytokines, there's inflammatory factors, there's interleukins, like there's all of these inflammatory factors that get spit out in the blood.
What is attacking to the body. Okay.
And so then the blood vessels get really dilated and they can't constrict, and then your blood pressure drops, and now you're not getting blood, you're not getting oxygen to any of the parts of your body. Now your organs start getting damaged, multi-organ failure, all kinds of problems. Your liver is getting damaged, your spleen is getting damaged, your lungs are getting damaged, ARDS.
Okay.
All kinds of things. Then the infection is still progressing, so you have to give antibiotics, but also some of the like bacteria, they have toxins, then they release the toxins. The toxins also decrease the blood pressure, fever, all kinds of things. Like it's a big mess.
Yeah, I can see your passion about this topic within the sepsis with the patients, and thank you for explaining to us.
Anytime.
Yeah.
Happily.
Okay, so Julia, my next question is, how do you think being a MD-PhD will shape the way you practice medicine or the research later in US or wherever?
I think it gave me a very good opportunity to see how research guidelines come into practice and to see how they're formed in the first place. And I think that seeing and reading so much of the literature now will really benefit in knowing what kinds of things my patients might benefit from in the future.
Yeah. That's important.
Yeah.
Yeah.
I will be up in the journals. reading. No, but really they're interesting.
Yeah.
Because you start reading the papers and you're like, I don't really understand where this is going. But then the more papers you
Yeah.
read and the more you start to understand the scientific
That's
language.
true. It also works same
Yeah.
for me because I was feeling very lost and I didn't know
Yeah.
like where to look, what are the methods, what are the results, what are the study design types, and once you are in it,
Yeah.
by time, by patience, you kind
You
of get
learn.
familiar. Yeah, I agree.
And then you
on
can
that.
read a study and understand like what was happening.
Yeah, and your study designs, they are both systematic review and meta-analysis, right?
The first is a
First one?
systematic review and a meta-analysis, and the
Uh-huh.
second one is a protocol for a randomized controlled trial.
Okay. Well, I know, but shall we briefly mention about the study designs? Like, what is the meta-analysis and systematic review for the audience?
So meta-analysis
Okay.
and systematic review is essentially you take a bunch of high-quality papers, usually randomized controlled trials, sometimes depending on the topic. If there's not enough data, you can also include observational trials. And you pool the data from all of them. And so you can kind of get an overview on the entire field. And it's sort of like summarizing what everyone has found up until this point on a certain subject. And that way you can see, you know, not just in one study, but you can also see the risk of bias, how one study may be biased, but you can see how the studies compare to each other. And then hopefully you can get a more cohesive and comprehensive answer to your question.
So it has the most strong evidence,
Yes.
basically, in the based on the Prisma guidelines.
The
it's
Prisma
the top.
guideline.
Yeah, and in the bottom of the Prisma, it's the doctor's opinion or expert's opinion. So
Yeah, like those letters to the editor.
yeah, the letters or the conference abstracts,
Yeah.
whatever. Yeah. So for our lovely lower year medical students, looking back, if you could tell first year student one thing about the journey ahead, what would it be? Back to anatomy, histology, those or second year physiology,
Yeah.
like overwhelming years.
They were overwhelming.
Yeah.
What would I say? Have fun.
Mm-hmm.
I don't know. I feel like, especially for me, when I started, because the system was so different from the American school system, when I started, it was like everything was very overwhelming. Everything was very chaotic. I walked in the first day of anatomy, there's a dead body. Like, I didn't know what was happening, you know?
So many cadavers. And I think, yeah, the way you learn the things, the material is also different compared to high
we never
school.
had oral exams. That was my first oral
Same.
exam. I walked in and I sat down and they gave me the topic and I sat there because I thought they would ask me questions. I thought it was like a written exam but verbal. And I sat there and he sat there and I sat there and he sat there staring at each other and eventually he was like, "Are you going to talk?" And I was like, "About what?" You know?
What's the question?
And what's the question? And he was like, "Just talk about the liver." And I was like, "So the liver is an organ?"
Yeah.
You know, it was,
Yeah.
but it's a learning curve. But anyway, the point is have fun because I think
Yeah.
everyone gets so serious and so stressed about it that they forget that it's like, I don't want to say not that serious because it is important that you should learn the things.
Yeah, but Budapest is also
But
a lovely city.
Yes.
So-
Budapest is a great city to be a student in.
Yeah, definitely.
I think don't forget that you need also somewhere to blow off steam in your life. And it can't just be 100% academic everything all the time because you'll burn out.
Burnout, exactly. Balance is the key.
Yes,
Yeah.
balance is the key.
So until now, during these 6 years, how do you manage stress and avoiding the burnout?
I intentionally have fun.
Yeah.
Like I intentional in the times when I'm having fun, then it's intentional that I don't feel guilty about not studying because I see a lot of people who like they'll go do fun things or for fun, but then the entire time they feel like they're guilty that they're not studying and they're counting how
Yeah.
many hours I didn't study today and how many hours I could have been studying today, and then that doesn't count because then you're not having fun. You're just feeling terrible and not being productive.
To missing the study hours, actually, that's true.
So I think if you like, you need to have fun and you also need to be aware that you need to have fun and not see it as like a detraction from your study
Yeah,
time.
when you have the break, like stay in the
Yes.
moment, be mindful about
That
it.
it is actually a break.
Yeah, your study, like your uni life won't collapse just you are going to gym for 1 hour or celebrating a birthday of a friend
Yeah.
for 1 hour. Yeah.
And Budapest is such a great city. There's so many interesting things happening. There's so much to do. Like,
Especially now in spring.
go to the park. I love the
Yeah.
park. Do not go to the park with your ankies.
No, leave the
Go to the
Ankies
park
at
and have a
home.
picnic. Throw a frisbee.
Yeah.
But studying outside.
Studying outside, yes. But like then you know that you're going to study. Then you're not going to a picnic, you know?
Being
Separate.
intentional.
Yes, being intentional.
Yeah.
Studying outside is great though.
Especially now.
Studying
Student
outside.
pro tip, study outside.
Study outside.
Yes.
Get the vitamin
Get some
D.
air. Get some sun.
Vitamin D.
Oh my god, the library. When you go to the library and there's no windows,
Yeah.
and then people are there for hours and hours and hours, and it's
Depressing.
like all you see is four walls
Yeah.
every day.
There are some nice, fancy, like Harry Potter vibes libraries in Budapest, though. No,
Yeah.
like Sabo Erwin,
Yeah.
All of them.
the Parliament Library.
There's museums, and you can actually study in museum coffee shops, and they're very
Yeah,
pretty. Like if
yeah.
you go to the Nemzeti Museum, it's in Calvin, you know, the big one.
Mm-hmm.
They have a coffee shop. It's a very cute coffee shop. You can study in there.
Yeah, that's true. Yeah. If you can't focus at home, if you feel like you need to change the environment a little bit, which also helps, I think.
Yeah.
Yeah, it's
Or go to Városliget.
Or go to Városliget.
Városliget,
But if you're in Városliget, you're in Városliget. So
Yeah.
bring the Yankees.
So-
This is such my pet peeve because you go to dinner with your friends and like the first thing you look at the menu and then you look at the Yankees and that's it. And then your face is just covered and you try to say something and they're like, oh, just at the end of this thing. And you're like,
Yeah.
but it's a dinner. It's
That's
what,
a-
30
yeah.
minutes? You can relax. You let go of the Yankees for the dinner time.
Yeah, that's a very sad fact actually. Like I celebrated my birthday yesterday and at some point all we talk about the internal medicine exam which is next week. I'm like, guys, please, it's the birthday party. Let's enjoy our
Yes.
birthday cake and I don't know, speak about something else, not only like uni,
Yeah.
uni, take a break and be intentional about it.
And travel.
Yeah.
Go somewhere.
Budapest is like the one
It's
of the
close.
best locations
Yeah.
to take the flight and leave for a weekend, you know?
And see, I will say you can do your Yankees on the flight.
Yeah. That's true. So Julia, can you give us a few tips about how to start research, how to find your supervisor, also how you would know that they are the good supervisors,
Yeah.
and for the students who are seeking for engaging in the research as a TDK student, what is being a TDK student?
So a TDK student is like a student research, and actually it's mandatory to be a TDK student before you become a PhD student. So you can only apply if you have some kind of a research experience. It's not actually necessary that you do it in the same field or with the same group. I did my TDK with the Hungarian Space Program in Városmajor, and then I did my PhD in the ICU with intensive care. So it was two completely separate fields, but just them knowing that I had background in research and I had done research essentially. So I kind of wasn't coming in blind. I would say the best way to meet the people is by shadowing, probably, because then you can really see what the specialty is like and also what the people that you're working with are like. So
Yeah.
I knew that I would be in good hands with Jenner as the
Yeah.
supervisor because I saw how he was as a doctor.
Yeah.
And even he was teaching me so much when I was shadowing. So I knew
Yeah,
it would
that's
be a
true.
good situation. And also, I think if your supervisors seem really enthusiastic about the subject, that's very important. Like that they are actually enthusiastic about wanting to supervise and wanting to do the research and they're actually interested in the research question itself. That's very important because I know a lot of issues can arise if you really want to get this project moving, but the supervisor doesn't care.
Yeah, then you have the whole work on your shoulder,
Yeah.
which makes the life a bit more difficult, I would say.
And that they communicate well.
yeah, that's true.
That's very important.
Yeah, I also helped another PhD student in your department, and I literally witnessed how they were really being there for you.
Yeah.
And I had the chance to carry one of the research to the TDK conference, and during even the presentation, the speech, and how is the PPT look like, with one call, like, okay, Basha, come, let's practice about this. Like, I think finding the good supervisor is also as important as the topic and
Very important. Yeah, definitely.
journey.
Because the supervisors make or break the entire journey.
Yeah, that's true. I completely agree on this one,
Yes.
Julia. And even though you're not planning to do a PhD, I think being a TDK student and starting to engage in the research, getting the co-authorships will enrich your CV.
Yeah.
So it's important to start from somewhere. And I would also add that in clinical year, we have so many like rotations. The doctors are doing the bedside practices and everything. Just be brave and approach them. So
Yeah. Most of them are very, very interactive, very sweet,
yeah,
want to talk to you.
they will be happy to see a student who is interested in their department and want to help with the research. They will welcome you. So just be brave and step up, go to them and talk. Do you have any research going on, or I don't know.
That was how I found my TDK. The woman who was in charge of it, she did a presentation once, and then I found her on LinkedIn, and I LinkedIn DM'd her.
LinkedIn DM, yeah. Oh my god.
I slid into the LinkedIn DM.
Yeah.
So-
Yeah. I mean,
But she
why
was so
not?
nice, and she was so nice about it.
Yeah.
And then she
why
said, "Come
not?
in.
Don't be shy. Why
Don't
not?
be shy.
Yeah.
Slide into those LinkedIn DMs."
Like, exactly. I even participated in one of the conferences in abroad, and I was just going and starting a conversation. And once you introduce yourself and start with the question, like, it just flows. So take the first step, and the rest will follow, guys. Yeah.
Good advice.
So, Julia, thank you for joining us today in our little studio. As a Hug team, we were very happy to see you in here. You gave lots of tips about USMLE, how to start the research, being a TDK student. What else?
A lot of things.
A lot of things.
A
I
lot of
can't
things.
count. Lots of
things.
take-home messages from our video. And do you have any few sentences as a guidance for the students, the closures? What do you want to say to them?
Thank you for bringing me here.
Of
And
course.
I would say be brave, try a lot of different things, be open to specialties that you didn't think you would enjoy, and explore Budapest.
Yeah.
That's, yeah.
Yeah, explore Budapest. It's a great city, guys. And
Yeah.
I'm wishing you all the best for your board exam and
Thank you.
also the future career ahead in
Thank you.
US, in Hungary,
Wherever.
or everywhere, wherever you go. Yeah, thank you, Julia.
Thank you.
I think Mia has lots of work to do.
so much.
Cheers to parents of Julia. We can cut. Yeah, I can really see your patience.
Sorry. Have fun.
Yeah.
Tell them that's my message. Have fun.
Yeah.
Have fun with it.
Have fun.
Have fun with it.